As Trust Innovation Leaders, we were proud to nominate Scott and the Application Development Team. The team have worked with staff from across the Trust to develop their ideas and to put them into practice. The team take great care to ensure the essence of the innovation is captured accurately, and then they go on to challenge and encourage the innovators to describe how the application will work in practice.
Some of the amazing developments they've worked on this last year include HARP, the Healthcare Assessment and Revalidation Portal. PAUSE is the Paediatric Admissions Whiteboard System developed by the paediatric Stafford developers. We know that they've definitely developed great innovations across our trust, and they're an inspiration to our clinical teams in making developments improve patient safety and care.
Good luck, Scott, and the Application Development Team. We know you deserve this award, so our fingers are crossed for you.
Julia's been instrumental in the improvement of the respiratory department after learning about an innovative idea of remote home monitoring of non-invasive ventilation. Non-invasive ventilation is the provision of ventilatory support to the patient's upper airway using a mask. Julie has developed the practices of her service with the patient at the very heart of this development. After initial assessment, education and support in a face-to-face consultation, it is then possible through home monitoring to adjust and improve the patient's therapy through increased reviews, which can now be done in a timely manner. The patient's feedback has been very positive, and they find it reassuring knowing that there is a kind and skilled nurse keeping a watchful eye on them, even though they are not with them in their own home. Julie is clear that this is only the start of this development and is eager to develop and enhance this innovation with her other cohorts of patients. Julie is truly a credit to the nursing profession and remains a passionate advocate for her patients.
Dr. Tom Salkin, Consultant Radiologist, has been nominated for this year's Inspiration and Innovation One and All Award in recognition of his forward-thinking, clinical insight, his energy, drive and sheer determination to assure a local PET-CT imaging service for the population of Cornwall. PET-CT is invaluable in diagnosing and staging cancers, assists in determining the most appropriate cancer treatments and in assessing the effect of cancer therapies. PET-CT is a highly specialised examination and scanners are only usually available in major cancer centres. In 2015, it was a real coup for Dr Salkin and the Trust when NHS England announced that Truro had been agreed as one of only 5 new sites for PET-CT in the country. The shiny new Alliance Medical PET-CT unit is testament to Dr Salkin's fantastic vision, innovative solutions and inspiring energy.
I want to nominate Bridget White for one of the awards this year. She has worked as an inspirational and innovative physiotherapist for this trust for the past 20 years. She set up the neonatal in-reach, outreach therapy work almost 10 years ago. Her skills as physiotherapist, always putting the patient at the centre of her work, are exceptional. As a specialist, highly trained physiotherapist, she recognised the significance of early intervention long before her peers. She put this into action by working closely and building working relationships with the medical and nursing staff on the neonatal ward. Bridget works tirelessly with the babies and children on her caseload. She has recently discharged an 18-year-old young man who she has been treating since shortly after his birth. Bridget's commitment makes her an inspiration to all who work with her. Bridget deserves recognition for this work, as not least, she is not a person to seek out thanks in any form.
The physiotherapy team at St Michael's Hospital, led by Susan Hawkins, have worked hard to implement an enhanced recovery programme for all elective orthopaedic patients. Enhanced recovery is about empowering the patients more, enabling them to lead their care. It encourages them to get up and going quickly, making them feel less like a patient and more like themselves. This means that they mobilise the hip and knee replacements on the day of surgery, meaning that the average length of stay for the patients has been reduced. This, in the long term, will mean an increased revenue for the Trust. Patients like it as it reduces their time in hospital and gets them home to their families much sooner. It has taken a lot of time and effort as they've had to liaise with consultants, anaesthetists and the ward teams to change practice at all levels. I really feel that the physiotherapy team worked really hard. They're the best people to get this award.